Good evening. My name is Franz Dalla, and today I have a very important issue to discuss. Imagine that you are on a beach swimming in deep waters. All of a sudden, your right leg begins to cramp. Your feet and toes want to extend, but that will cause the pain to become worse. You need to plant your feet and toes on a flat surface for the pain to go away. But you remember that you're in deep waters and there's no one to save you. I've worked in many dialysis clinics for many years, seeing staffs running around during transition time, trying to catch up with the schedule. Because these dialysis companies are profit driven, they fill these dialysis clinics full of patients where the current patient to staff ratio is 4:1, compromising patient safety. Now, this causes patient outcome to decline. So we need a bill to pass through the House and Senate to change the current practice. According to ProPublica.org, there was 2 incidents where patient safety was compromised. One was a woman died from Renalin exposure during dialysis initiation. The other one, Barbara Scott, nearly died from needle dislodgement. That's when the needle comes out of the access, and it was hidden beneath a blanket, and the patient nearly died. Failure to comply to policies and procedures will lead to mistakes, causing dialysis patients to go to the hospital. According to the same ProPublica.org, almost 60% of professionals have said that mistakes of dialysis setup, wrong dialyzer, bath, occurred prior to within 3 months of this publication was written. As I mentioned before, patient outcome declines due to high morbidity and mortality rate is high. Patients end up becoming sicker and they end up in the hospital due to infection or accidents that occurred in these dialysis clinics. So what I found in leginfo.legislator.ca.gov, that there is a bill in the House right now that's being pushed to change the current practice of 4:1. Senator Laura, with the help of Senator Bradford, Hertzberg, and Newman, amended the bill, Senate Bill number 349, but won't occur or take effect until 2019. One of the provisions are the current ratio of 4:1 will be cut down to 3:1, and for every 8 patients, 1 nurse will be supervising their care. Now imagine that the patient sitting on that dialysis chair is your relative, your mother, your father, your brother, your sister. Knowing what you know, will you allow these dialysis clinics to continue the current practice and putting your loved one at risk? This needs to change. So we need to urge our representatives so they know that there is massive support within our community. Remember, they are not just patients, but they are people too.